Letromobile for cytomegalovirus prophylaxis in hematopoietic cell transplantation. Definition: cytomegalovirus (CMV) diseases that result from CMV replication through reactivation or new infection is a serious, potentially life-threatening condition in immunocompromised patients. This is especially true for recipients of allogeneic hematopoietic cell transplants. Letromobile, previously known as AEC246, is a new highly potent anti-CMV agent with a novel mechanism of action targeting the viral terminus subunit.
In terms of another virus that sometimes comes, brings up a lot of questions as to testing. There is one virus called cytomegalovirus, and cytomegalovirus gets its name for what it does to the cells. It actually, under the microscope, makes the cells like giant cells or something. They look very big, and so the name cytomegalovirus. In a simple manner for the lay person, I think it's the model that we all know of chickenpox and measles and German measles and childhood illnesses is a good example of how most things respond with cytomegalovirus. First of all, the vast majority of the population has been exposed and has had cytomegalovirus. It often will happen in childhood or adolescence, teenage years, early adulthood. It will be exposed through some kind of intimate contact, whether it's a sneeze or a kiss or something else, sexual activity possibly. It shows itself as an influenza-like syndrome. Fever, you don't feel well, you're not hungry, you're nauseous, you're vomiting, you don't want to get out of bed, you want to sleep, you're dizzy. It looks like a flu. And for the vast majority of people, they will have a bad flu with maybe 102 fever for an adult. That's a lot of fever. And it will pass, and that will be the end of it. And they'll think that they just...
Standard treatment. The standard of care for treatment of CMV infection or disease has typically been intravenous ganciclovir or its oral product, valganciclovir, or alternatively intravenous foscarnet or cidofovir. Letromobile, previously known as AAC246, is a new highly potent anti-CMV agent with a novel mechanism of action targeting the viral terminus subunit.
They just had maybe some kind of a flu, a seasonal flu or something, and in fact what they had was a CMV. When a mother who was pregnant gets CMV, it's in different sections, and it crosses the placenta. It infects the fetus. The fetus has an immature immune system, and so if the fetus can cause
Pros and cons. Letermovir, previously known as AEC246, is a new highly potent anti-CMV agent with a novel mechanism of action targeting the viral terminus subunit. As such, letermovir also provides a potentially new treatment option for patients infected with CMV strains that are resistant to approved antiviral drugs.
Had an infection in the past that's of a determined date and now has immunity to that virus. IgM shows that someone, if it's high, has had the infection on a more recent basis and is either fighting it or has the infection at the present time. Normally, as time goes by and you're in a convalescent phase, the IgM levels go down to a lower level. The IgG levels stay somewhat elevated. If you're ever exposed to CMV 5 or 10 years later, both levels will initially go up, but the IgG levels go up much higher and stay higher longer. And this is what will inactivate the virus from ever reinfecting your cells. A large percentage of the population is CMV positive. It does not mean they have the virus at the present time. It means they've been exposed to the virus in the past and are now immune, just like it would mean they've been exposed to German measles or chickenpox or regular measles in the past and are now immune. The question comes up as to what kind of donor to get, whether you get a donor who's CMV positive or CMV negative. To some degree, it depends on who the recipient is going to be for that donor. And if it's someone who's CMV positive, that woman has been exposed to CMV in her past, it makes no difference at all.
Prophylaxis trial. In this phase 2 prophylaxis trial, oral letermovir at once daily dose of 120 mg and 240 mg as compared with placebo was efficacious in preventing CMV replication in recipients of allogeneic hematopoietic cell transplants. Overall, the incidence of virologic failure decreased with an increasing dose of the drug. In addition, letermovir at a dose of 240 mg per day significantly reduces the time to the onset of prophylaxis failure.
She's immune. She will protect the baby with her antibodies from ever getting a CMV infection, and she can work with either a CMV positive or CMV negative donor. The CMV negative recipient, a little bit of a different story. While she will not get CMV from the donor, if for some reason
Conclusion: letermovir, as compared with placebo, was effective in reducing the incidence of CMV infection in recipient